Dipyridamole, a non-nitrate vasodilator. Our generic name is dipyridamole, and our brand name is Persentin, with a chemical name of dipyridinopyridine-5,4-dipyrimidine 2,6-DL dinutriotetraethanol. That's all my aliases, so if you ever hear any of my names, they all just refer to us, dipyridamole. Pharmacists classify us according to our use, and D2 is here to tell you all about it.
Whew, those are some names. Now let's talk about our drug classifications. Our therapeutic drug classification is antiplatelet. We do that by inhibiting thromboxane A2, which has a prothrombotic properties as it stimulates the activation of platelets and platelet aggregation. Our next therapeutic drug classification is vasodilator. We increase blood flow through selectively dilating coronary arteries. Coronary vasodilator effect follows inhibition of serum adenosine deaminase, which allows accumulation of adenosine, a potent vasodilator. Our pharmacologic drug classification is pyrimidine analogs. We increase the anti-cancer drug's concentration in cancer cells and hence enhance the efficacy of the treatment of cancer. We are quite useful, aren't we? Next, D1 will talk to you about our impact to the fetus. D1?
Yes, that's right. We have a pregnancy category of B. Taken only by a limited number of pregnant women, it shows no direct or indirect harmful effects on the human fetus. In animal studies, it has shown no evidence of an increased occurrence of fetal damage. That's all from our pregnancy category. I'll pass the baton to D2 to tell you all about our mechanism of action.
Yes. Thank you, D1. Our mechanism of action. We inhibit phosphodiesterase and adenosine deaminase to prevent degradation of cyclic adenosine monophosphate, which is an inhibitor of platelet actions. This elevation in CAMP blocks the release of arachidonic acid from membrane phospholipids and reduces thromboxane A2 activity. We have a fun job, don't you agree? Now D1 will talk to you about how we are absorbed, distributed, metabolized, and excreted inside the body.
Yes, our pharmacokinetics. In the absorption of your body, it is variable and slow. Its bioavailability is 27% to 59%. Our metabolism occurs in the liver. Excretion occurs via biliary excretion of glucuronidase conjugates. Some may undergo enterohepatic circulation and fecal excretion. Only a small amount is excreted in the urine. Its half-life varies from 1 to 12 hours. That's what happens inside your bodies when you take us. Remember that like a candle is only needed in darkness, you should only take us when you need us. So, when do you need us?
As an adage stated, nothing is ever absolute, for there will always be consequences. With that, take note of the following because I am only limited to be used as an adjunct to coumarin anticoagulant, which prevents post-operative thromboembolic complications caused by cardiac valve replacement. I am also used to help with transient ischemic attack, which is a temporary period of symptoms similar to those of a stroke. Moreover, I am also used to help with a cerebrovascular accident or stroke through my antiplatelet and vasodilator action. Did you take note? Because D1 will discuss to you next when you are absolutely not allowed to use us.
Yes, our contraindications and cautions. Things you should be careful of. Hypertension, orthostatic hypertension, and syncope. We should not be taken in by patients with these conditions because we can exacerbate their present condition. asthma, we may increase bronchospasm. We are not effective in relieving unstable angina pectoris and should not be substituted for appropriate anti-anginal therapy. During pregnancy and labor, we should be administered to the pregnant women only if clearly needed, because we can decrease platelet aggregation and increase risk of bleeding during labor. According to a manufacturer, we are excreted in human milk and should be administered with caution to nursing women. The effect of our exposure on a nursing infant is not known. Hepatic disease. We have been associated with elevations of hepatic enzymes and hepatic failure. When geriatric patients intake us, they become more susceptible to orthostatic hypotension. Current use with anticoagulants or NSAIDs may further increase the risk of bleeding. Those are all the times that you don't need us. But when you need us and you're not mindful of how you use us, here's D2 to tell you all about it.
Are you familiar with these symbols? Yes, you're right. Those are symbols used for caution or warnings. Because now, we are going to talk about our side and adverse effects. First off, our side and adverse effects on the nervous system. Headache. Headache is a common adverse event in patients treated with dipyridamole for secondary stroke prevention. The headache resembles a migraine. Dizziness and faint. Dipyridamole can reduce your blood pressure, hence making you feel dizzy. If the blood pressure becomes too low, fainting occurs. Next is the cardiovascular system. Hypotension. As I have mentioned before, dipyridamole can cause a low blood pressure due to its vasodilating action. Other reactions from uncontrolled studies include diarrhea, vomiting, flashing, and pruritus. Angina pectoris has also been reported, but reports has been rare. Bronchospasm. Dipyridamole enhances adenosine-induced bronchoconstriction in asthmatic subjects. Potentially fatal side and adverse effects. Cardiac death. Sudden cardiac arrest is not a heart attack, but can occur during a heart attack. Sudden cardiac death is a sudden unexpected death caused by a change in heart rhythm. Myocardial ischemia. Dipyridamole-induced myocardial ischemia has been demonstrated to occur in animals and humans with coronary artery disease. Asystole. Asystole has been reported during the administration of dipyridamole. This side effect was only reported in patients with coronary artery disease or beta blocker therapy. Yet the cases lacked both concomitant factors and autonomic dysregulation is suggested as a cause for asystole. Did the side and adverse effects bother you? Don't worry, most of the side effects are only manifested with prolonged use of dipyridamole. Moreover, nurses are always on the rescue for you. D1 will explain the nurse's responsibility when you take dipyridamole.
Here are the things that a nurse should keep in mind. Monitor therapeutic effectiveness. Clinical response may not be evident before second or third month of continuous therapy. Effects include reduced frequency or elimination of anginal episodes, improved exercise tolerance, and reduced requirement for nitrates. Another thing is observe for signs and symptoms of bleeding. Note prolonged bleeding time, especially with large doses or long-term therapy. Also, you should notify physician for any adverse effects. Another thing is to make all position changes slowly and in stages, especially from recumbent to upright, if postural hypotension or dizziness is a problem. Do not breastfeed while taking this drug without consulting a physician. Patients should take us exactly as prescribed. For the evaluation, monitor patient's response to therapy. Monitor for adverse effects. Monitor for effectiveness of comfort measure. Monitor compliance to drug regimen, and also to monitor laboratory results. most of the things a nurse should keep in mind. Now remember, medical knowledge is power. Now pass it on.